Welcome viewers. Today we are going to discuss about airborne viral diseases, the symptoms and possible treatment. The outline of today's lecture is as follows. I will first introduce you to the airborne diseases, especially the airborne viral diseases, and we will restrict our discussion to airborne viral diseases in humans. Then we will discuss about the causative organisms, the possible symptoms which are associated with each of the diseases, and then we will discuss about the mode of transmission, and lastly the treatment and possible precautionary measures which will prevent the occurrence of such disease. So coming to these viral diseases, first we should discuss about why we need this knowledge about all these diseases. All of us, at least me or some of my students, are always affected by common flus, especially during seasonal changes. This happens because the causal organism is some virus which spreads from one infected host, which in this case may be the human, to the other by aerosols or by other droplets of water which pass through the air. For example, if we sneeze, we are actually throwing out viral particles or in small droplets at a speed of 50 to 200 miles per hour, and they can travel a long distances and can infect the individuals who come in contact with them. The susceptibility of the individual to that infection will vary depending on health and other environmental factors. So taking into account all these things, we should first discuss about why and what major types of viral diseases which are airborne in nature, and this knowledge will help us to get us aware of all these diseases, how to prevent them, and how to vaccinate ourselves against these diseases. So let's start with one of it. The first and the most common of it is influenza, which is called the common flu. The causal organism in case of influenza is a RNA virus under the family Orthomyxoviridae. And the influenza are of various types. First is influenza type A, type B, and type C. And all these are very important in causing diseases, but of which influenza type A is most well known to cause human diseases. Now you can see a picture which is the EM picture of the influenza virus. Now, how does people get infected by influenza? The influenza is transmitted through sneezes, coughs, or through various aerosols, and the virus is present as small droplets, and they can get contaminated through the skin or through the respiratory tract and can sit in the lungs, in other parts of the respiratory tract, and they can replicate themselves. However, I should mention at this juncture that 50% of the influenza infections are asymptomatic in nature. That means they don't develop any symptom. You are not aware whether your friends or whether your relatives are having it, but they actually provide a potential threat because they can spread the disease better. Now coming to the symptoms, the first is, if we look at the figure, the first is at the central nervous system, you will get an headache, you will get fever, you will get nausea, you will get coughing, and sometimes these are associated with joint and body aches. Usually they last for 3 to 4 days, after which they subside. Now it is during that time, if you sneeze or if you cough it out and the other individuals come in contact with it, then those individuals will get influenza.
Sir, we have often faced influenza infections during seasonal changes. Can you tell us some methods to prevent it or treat it?
Very good question. And that is a common question throughout the world. The general guidelines for influenza treatment is to take plenty of rest, to take plenty of water so that your body gets rehydrated, and you can take some occasional painkillers. But it's better not to take any antibiotic in the initial days because they might prevent you from secondary infection, but they actually don't kill the virus. What's better is sometimes it's good to take antiviral drug like Tamiflu, but only if it takes severe proportions. So if there is huge fever or high fever, it's good to take medicines like paracetamol, which will bring you down. But the most important aspect we should all be aware of is how to prevent influenza infections. There are certain protocols we should follow and which will prevent it not only in our household but throughout the world. The first and the most important thing is, if I have an influenza, I as a patient should be careful. If I sneeze, I should use a handkerchief so that the persons around us don't get contaminated. I should wash my hands thoroughly, and if I have some relative who is having that fever in the home, I should not go very near to him or her. I should take necessary precautions, and I should wash everything carefully so that the droplets does not stick to it and I do not get those infections. Now, coming to the second part of influenza, which is slightly different and which has caused a havoc in 2009 in US especially, it has gone through a pandemic proportion, is the swine flu virus. The swine flu is contagious and spreads in the same way as the influenza. The name swine flu is because it was first detected in the swines, and from that people got infected. But the most important aspect is not only from the swine but from infected people it spread to other peoples because it was carried through air. It was airborne in nature. So what are the symptoms? The symptoms are similar to influenza, only that they will have very high fever for 4 to 5 days running. And then there can be vomiting, there can be abdominal pain, and in pregnant women, it can lead to some changes in hormonal balances which will affect the birth of the child. So we should be careful while swine flu is there. Now, if you ask me, what are the methods to treat swine flu? Now, already in today's world, we know that there are some nasal sprays and there are some injectable vaccines which are available, which was developed all around 2009 and 2011 and tested by the central drug agencies in different countries, and it prevents these diseases in most individuals, but it has its own side effect. Other than this, you can have some symptomatic cure of those diseases. That is, you can administer some drugs which will prevent pain, which will prevent swelling of the joints. And the best method is, during the course of infection, is to provide lots of fluid, lots of good air to that patient concerned. Now, there are drugs like Relenza and like Tamiflu which are antiviral in nature, but again, administration of the drugs depends on the severity of the disease. Now, we go to another important disease which are widespread throughout the world, and especially the children are more prone. These are the measles. The measles are caused by a virus which is an enveloped single-stranded RNA virus of paramyxoviridae family, and the name of the virus is morbillivirus. And you can see in this picture, this is a morbillivirus, and what happens is the morbillivirus goes and sits on the host cell membrane which has some receptor. It gets stuck to the host cell membrane and then it goes inside, it throws out its envelope, and then it can replicate using the host machinery. So once it is there, it causes lots of symptoms. It was first detected by Enders and Thomas Peebles in 1954 from the Koplik spots, which are small warts which are formed inside the mouth, and they took the swabs and they tested it and they found these types of viruses present. Now, what are the symptoms which are happening in this virus? The virus gets readily transmitted through air, and it can get deposited in the lungs, and first infection which is caused is the lung infection. Other than this, it can cause oral infection, it can cause conjunctivitis, it can cause GI tract infection, but the most notable thing are rashes over the body. And this can also cause urinary tract infection. The incubation period for most of them is 14 to 18 days. And during that 14 to 18 days before and 6 days after the rashes have appeared, that patient is highly contagious in nature. That means those who are coming in contact with that patient, or those are using the same linen or the same towels, they will suffer from the same diseases.
Sir, what are the classical signs of measles, and is there any chance of a secondary infection?
Good question. Yes, we get some classical signs of measles, and the most important are 4th day fever. You have a 4th day fever, you have head coldness, you have conjunctivitis, and then there are rashes and the Koplik spots. So what are the Koplik spots? The Koplik spots are white warts which are formed inside the mouth, and most cases people don't see the spots because they are transient in nature and you have to detect it at the time when they appear. So you can look at the picture where this is a picture of a girl having spots all over her body, and you can see the conjunctivitis which has happened. So conjunctivitis, we should be aware of that it can also be a sign of measles. Yes, and regarding your second question, can it lead to secondary infection? Because in measles, especially in infants, the immune system gets affected. At that time, there can be secondary infections, and these secondary infections, which can be pneumonia, which can be encephalitis, can be associated with measles and has to be treated accordingly. Now, coming to the treatment of measles, the most important is to take a shot. What is it? This is called measles, mumps, and rubella vaccine shot. If we have it at our childhood, then the chance of getting this disease is minimized. Other than this, to have these rashes, to take care of the joint pain, we can administer different medicines, and the presence of measles and the presence of measles infection in our body can be determined by anti-measles IgM antibody in laboratory test and correspondingly by polymerization chain reaction, which will definitely tell that okay, the measles has happened, and so that we can take necessary precaution. Other than this, as for influenza and other diseases, we should keep the patient in a good environment, mostly isolated, but keep him or her giving water and giving good food so that he or she recovers soon. Now coming to another important thing is the mumps, which is epidemic paratosis. Now mumps, like measles, is a widespread disease and especially affect infants. It's not that it will not affect the adults, but this disease is more widespread in the infants because of their less ability to fight these diseases. Now what is happening in these? It is a viral infection which affects the parotid gland. That's why it is called paratosis, and it affects the salivary gland. It is caused by a single-stranded RNA virus, which is the paramyxovirus, and it's spread through airborne droplets, through salivary secretions, and possibly by urine. 6 days before the onset of the symptoms to 9 days till the symptom subsides, these are the time where an infected individual can contaminate any other individual around him or her, and we should be careful. So that whole duration adds up to 16 to 18 days. Now what are the main symptoms? As you can look at this chart, there's a swelling here, which is the most important symptoms. That is, the mumps affects the parotid gland and there is swelling. There is loss of hearing in certain cases, and then there is fever and headache and anorexia. And in certain cases, especially in males, it can lead to inflammation of the testicle. But I'm not talking of infants, I'm talking of adult in this case. Now, how can we prevent or treat this disease? The best way to treat measles is to take the MMR vaccine shot, and these are live attenuated viruses which are put into you so that it keeps you prepared so that your body can fight these diseases. Then you can go for symptomatic treatment of the disease, and we should know one thing very important, that once usually if we have this infection, we will not get reinfected because there's a lifelong resistance to it. Another important disease is the chickenpox, and chickenpox is widespread even in India as well as in the developed countries. And this is the microbe which is responsible is the virus varicella zoster. Unlike what we have discussed till now, this is a double-stranded virus of the herpes virus group and has only one serological subtype. Involuntary actions like coughing, sneezing, direct contact with the infected persons, and even touching the foods which they have eaten, and touching the linens and touching their other clothes which they have used during an incubation time and after the incubation time may predispose you more to getting chickenpox. And it has been found that in immunocompromised adults, the entire period of the disease, he or she can transmit it to other human beings. So what are the symptoms of chickenpox? Let's look at this infant. All the body has rashes on it, and these rashes are characteristic because they are swellings and they form scabs and they peels off after some time, and that's how we can say that chickenpox is developed different from measles or mumps. And what happens is they form small red dots on face, on the scalp, on the torso, and they progress over 10 to 12 hours and form blisters. Now once the blisters burst and after the organism gets out, then they are fine. You will not get infected. However, these individuals can suffer secondary infections, mostly bacterial infection, leading to complications like pneumonia, lymphatic meningitis, and so on. So once we have chickenpox, we should keep the patient aware, isolated in a good environment, and feed him and be very careful about the secondary infections.
Sir, chickenpox is quite widespread in children, especially in India. How can we prevent it?
That's a very good question. The best way to prevent chickenpox is, if a person has already got it, is to isolate him or her for at least 6 to 9 days, not to allow him or her to get out of the house so that during that time he or she will contaminate others, and then to take the viral vaccine, which is also an attenuated virus, and chickenpox vaccines can be given to you during your infant stages so that during the lifetime you don't have it. Another thing is that once you have this varicella infection, in most cases you don't have it in a second time. But this belief is getting disturbed because some people still do have a second time infection, but it depends on other climatic factors and environmental factors. Poor sanitation, poor hygiene will lead to relapse of the diseases. I should hereby mention of another disease, which is smallpox, which is caused by variola. Now this was more of an epidemic few decades back, but nowadays, because of very good and efficient immunization program all over the world, it has been controlled, and recently in the past 2 to 3 years only has been reported in 1 or 2 pockets in Southeast Asia as well as in Africa, but in India is more or less controlled. So you see, good vaccination is necessary for preventing such diseases. Now we come to another important disease, which is severe acute respiratory syndrome, or SARS, and we all have heard of these. It's caused by a coronavirus, which is an RNA virus, and this first is present in birds as well as in mammals. This can also be present in human being. And you look at the figures, this is a stained specimen where we see the viruses, and it can again get attached to the host cell surface and can infect it. The virus belongs to the Coronaviridae family, and it created epidemics in China and Vietnam and a small outbreak in other countries few years back. The most common mode of transmission again is droplets, which are given out from the infected person by coughing or sneezing, and it can be transmitted through airborne routes. Air samplers which were present in some rooms found that SARS was present in air. This affected the nurses also in some hospitals, and when they tested it with PCR, these swabs, they tested positive for SARS. So once a patient gets affected by SARS, the best method is to isolate the patient from healthy human beings and then to medicate him or her. So how the medication will be done depends on symptoms. So what are the symptoms? The first and most important symptoms is high fever. The other symptoms are similar to influenza, but this high fever continuing for 4 to 5 days is most important symptom of SARS, and this can create lethargy, and this can create some non-specific symptoms associated with this, because when these symptoms happen, the individual is immunocompromised in nature to an extent, so secondary infections can happen, and this can lead to pneumonia, and these might lead to death. So SARS directly may not lead to death, but due to secondary infection may lead to death. How to prevent it? It's largely you should support the patient with good rehydrates, with good food, isolate the patient. If necessary, give some antibiotic and antiviral agents. And the most important thing is when SARS outbreak first happened, people used to keep them in negative pressure rooms so that the virus cannot go out of the room. It cannot go out and infect other individuals. And nowadays, there has been some vaccines which have been developed against SARS, but we don't get commercially available SARS vaccine readily over the counter, and I think these are soon it will happen.
Sir, we have heard about acute respiratory diseases caused by airborne viruses. Can you provide us with an overview?
Yes, of course. So, respiratory diseases, some of them are caused by airborne viruses. One of them are the adenovirus infections. We are looking at the picture of scanning electron micrograph of adenoviruses, and the human adenoviruses are non-enveloped in nature. They are icosahedral virus, and they are of the family Adenoviridae. They can cause life-threatening illnesses, particularly in immunocompromised patients, children, and elderly. The adenovirus spread by respiratory routes and by contact from person to person and by airborne aerosols. And as I talked to you about this has been substantiated by experiments done in the laboratory. Now, what are the symptoms of these diseases? The virus can cause both upper as well as lower respiratory tract infections. It can lead to pneumonia, urinary tract infection, and also conjunctivitis, and even when go to encephalitis. But primarily the infection is acute respiratory disease, and the first outbreak of this infection was reported during the Second World War. The most infections are mild. They don't require any therapy, but we have to treat the symptoms. For example, if I have fever, you have to treat it with paracetamol and other related medicines. If there are some headaches, if there are some body aches, you have to treat it with different medicines, and you have to give good fluid and good food so that the complications does not arise. There are lots of vaccines which are available, but mostly they were given to the military recruits. Nowadays, we have specific vaccines for acute respiratory diseases, and you don't see a widespread occurrence of such disease in today's world because of effective vaccination and because of awareness in human beings. Another related thing is the human respiratory syncytial virus, or the RSV virus. Now, this is again a single-stranded RNA virus of the family Paramyxoviridae, and this leads to infections, especially of the lower respiratory tract in children. Now, what is happening is if the children sneeze or if they cough up, these virus comes out as small droplets, and they can infect the healthy human beings in the surrounding area. And you can look at the picture. This is again a scanning electron micrograph of the RSV virus. Now, the outbreak of the RSV is clinically indistinguishable for the common flu or the influenza virus. The incubation time may be 4 to 5 days. However, once the incubation time is over, you see headache happening, you see high fever happening, and unfortunately, this, if it's untreated, and if you don't respond to any of it, then it might lead to pneumonia and loss of life. It can also create bronchiolitis. It can require hospitalization. It can also cause other respiratory problems like asthma, which are not direct cause, but these are indirect causes because of the presence of the disease. So we should be aware of it. Now, how to treat this disease? To treat this disease, one should keep the body hydrated. Till now, there is no effective vaccine known against this virus, so I can't provide you with an overview of such a vaccine, but we have to follow all the methods which we follow for prevention for influenza, even in case of the RSV. So today, what we have discussed some major viral infections which are airborne, and if you note it, most of the viruses are RNA viruses, except one, which is the chickenpox virus. Now, these are airborne and they're contagious in nature, so one should be aware of it. The patient as well as the healthy human being, the patient should, if he or she sneezes, she should use a handkerchief so that she should not handle everything when it is at its maximal time or during the incubation period, because that will lead to spread of the diseases. And one should take necessary vaccination in the childhood so that most of the diseases which are widespread in that locality or in that country is prevented.